Have you been told that your POTS, dysautonomia, or long haul symptoms are something you just have to live with?
And what if I told you that the missing link has to do with the thyroid? Would you believe it?
People come to you and say, no one's been able to help me. And you're like, we can do this quite easily. And just watch me go. Because you know some secrets, some things that other doctors have no idea about.
POTS is postural orthostatic tachycardia syndrome. So postural orthostatic tachycardia syndrome, okay, big long word. That's why they shorten it to POTS, okay? That being said, there's another name that people are, sometimes it's called dysautonomia, okay? Another long word. And there's a third syndrome that describes the exact same symptoms, and it's long haul. How many people watching or how many people do you know have symptoms related with blood pressure changes? Meaning like blood pressure can go up or down. How many people have symptoms where they feel like their heart rate is variable, really highly variable, meaning it can go crazy up, crazy down? How many people with positional changes know that when you sit up or when you lay down, there's vertigo, there's dizziness, but there's also these heart rate changes that go with it, right? Mm-hmm. And not only that, what about dizziness? What about fatigue? What about brain fog, right? And, so just thinking about some of those symptoms, and then not to even mention, some people haven't even linked in all the allergy, histamine, gut-related symptoms that could be tied with the syndrome that we're talking about. So this is the first time that people really realize that POTS, postural orthostatic tachycardia syndrome, just describes a group of symptoms, and they put a fancy name on describing this group of symptoms. Most of the people I work with never even have any one of these diagnoses. They just have the symptoms, and the doctors will say, well, you don't qualify for POTS, you don't qualify for dysautonomia, you don't quite qualify for long haul. Therefore, there's nothing wrong with you. And just because you don't have a diagnosis name doesn't mean there's nothing wrong with you, and doesn't mean that you don't have this syndrome. You know you do. If it doesn't belong to the cardiologist and it doesn't belong to a neurologist, well, how does the thyroid fit into this? And should I see a thyroid specialist? But it has a lot to do with the thyroid.
And that's a huge time waster and frustration then for people who are going through the motions and trying to get help, because they're going to these specialists and they're not getting anywhere.
And so I want to know how many people have gone to the heart doctor or the neurologist and haven't gotten the help they needed, results, meaning from this, right? Which is why today I just want to do some definitions on it so that you know what I'm talking about. Because most people I work with, and I've worked with thousands of people in this category we're talking about. I was talking with a bunch of our clients, and we were talking about how many people here with have symptoms relating to POTS, long haul dysautonomia. 90%, right? And I asked the question, how many people here discovered while working with us that you have a hidden thyroid problem? 90%. Because I literally have collected one of the largest population of people with these symptoms, and I have been testing them right? Because number one, I'm going to tell you one of the biggest problems is, well, you're like, why did these people come to you with being told that the tests are normal and that their thyroid is fine? Because most of these people have never had a thyroid test, number one. And number two, if they had a thyroid test, it's the wrong test, meaning that it's just TSH, right? TSH to me is the most insensitive way to actually figure out if someone has a thyroid problem or not. People can have different types of thyroid problem. People can have high thyroid. People can have low thyroid. People can have fluctuating thyroid. Okay. So let's just get that out there. All of these thyroid problems can produce symptoms that are blood pressure changes, circulation issues, heart rate issues, right? Weight changes, brain fog, fatigue, right? Hair loss, right? And swelling, like any of these. If anyone tells you otherwise, meaning, oh, these are normal, these are normal variants. They happen for no reason, or they're fine. It's wrong. It's just wrong. I look at the thyroid as the canary in the coal mines. Okay? Because, and I'm going to tell you this, the thyroid, if there's anything wrong with your immune system, the favorite first target and consistent target loves to tax the thyroid. So if someone gave you the Rosetta Stone, meaning like the cipher, you get the labs, you get the cipher, and you're able to look at the thyroid and be like, whoa, this literally gives you a whole pattern of what's going on with your immune system. That's what I'm talking about. Like, you can look at what's going on with these thyroid labs and you can be educated on understanding, and you have the cipher and you look at it and you're like, oh, wow, this is what's happening with my immune system. The thyroid is the secret to actually understanding what's happening with your immune system, and also being able to understand, wow, how much of my immune system is actually trying to attack me.
You, I've seen uncover patterns that no one else has, Dr. Maggie, in that, sure, if you're seeing your immune system attack your thyroid, you can also connect it to either the autoimmune attack is not going to stop there, and if you don't address these things, eventually you will have other issues, or they already have other issues. And you've even connected it specifically to things like connective tissue disease. People often have thyroid problems. I've never heard anybody else talk about that before.
This is from my own experience, because in my own story, I had to discover, number one, I went to early menopause at the age of 36. They said I was getting older. I wasn't. That wasn't the reason. It wasn't until years later, through my own discovery, learning, testing, and understanding, that I actually had an autoimmune thyroid disorder called Hashimoto's, where my immune system was attacking my thyroid, right? But I started to make connections because I started gathering a huge practice in my functional medicine clinic at the time of people with hormone problems that were really difficult to treat because they kept fluctuating. And it turned out that universally, almost every one of those people had an autoimmune condition going on, meaning that their immune system was somehow involved in attacking their hormone-making organs, whether it's thyroid or your ovaries, your adrenals, or even your pancreas. So I started to notice in myself, I was like, oh, wait a minute. I had early menopause. I'm taking these bioidentical hormones, but then it kept fluctuating all over the place. And then I discovered later, holy heck, I have an autoimmune disease attacking my thyroid. And I started to realize there is huge opportunities that I can do to stop an autoimmune attack. Just because you have an autoimmune disease doesn't mean you're screwed. There's so many things that you can do here, because I don't read the normal manuals. You know, this is my life. So I wasn't going to go down with this. And I realized that if there was a way, and multiple ways and multiple tools with which I could turn off, turn down, and balance my immune system, decrease the attack, balance the immune system, not only did my thyroid get better, but then my ovary hormones started to make hormones again. And I just want to wake you up. Even if your doctors aren't awakened to this, I want to raise your level of awareness. There's hundreds of tools where you can go doom, 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 like surgical precision of what to do with this. I see people every single day with POTS, long haul, dysautonomia get better every day. So I want you to know that. And even if you're not certain about that, borrow the certainty from me, just because I see evidence of it. I've worked with thousands and thousands of people, fixable problems. And that's what I love, is this one simple concept that connects it all. And everyone has this one simple concept that's connecting what's going on with them. And I love seeing what that is. If you want me to do the live training in a couple weeks, put live in chat. I would love to see if I could get a couple hundred lives in the comments section. I will kick some ass and do it. All right. If you or anyone you know is struggling with POTS, dysautonomia, long haul, or unexplained chronic health symptoms like fatigue, brain fog, irritability, irritable bowel syndrome, which you know now, I think IBS is BS. If you're struggling with any chronic health related symptoms, I have a POTS and dysautonomia and long haul training series available. If you want the training series, look at the copy above or below this video, and we will get the POTS training series to you. It's a free multi-part training that shows you what are some of the underlying causes of POTS, dysautonomia, and long haul. Click the link below and watch my free training. Learn this one simple concept and be ready to get life back on track. Click the link below.